Edo State COVID-19 Response Committee press briefing. The Edo State government has embarked on a training of a total of 4,218 medical personnel across the state. And this will be the first set of people that will be trained. These persons already have basic training for handling crisis, but the skill level need to be updated to contain the emergent trend. They will be undergoing training. They will be undergoing train the trainer TOT section, after which they will go back to their respective facilities to train their colleagues. The health workers are drawn from private, state, and federal medical centers. We are ramping up medical supply to tackle this pandemic in the state, especially personal protective equipment, PPE. This is to ensure that any health worker who will be in front line during this outbreak will be equipped with complete kit to protect themselves. We are also working to increase the number of ventilators and other necessary equipment in our isolation centers. While we are working towards containing the outbreak, at the moment, we have received additional 12 ventilators today, bringing a total of 25 ventilators at the isolation center in Stella Obasanjo Hospital, and also in the Irua and Auchi centers. Edo State government is going to commence a massive screening and test for coronavirus in order to get a statistics sense of how widespread the virus is in the state, to ensure effective planning and commitment efforts. The enlarged Edo Response Committee on COVID-19 will continue to have visual discussion and meetings every day to monitor and manage the state response pandemic. Thank you.
Like we are aware, Edo State boasts of a number of isolation centers. We are aware we have one isolation center already prepared and set to receive any COVID confirmed case at Stella Obasanjo Hospital. But the state government is not resting on that. We are trying to expand facilities at the Stella Obasanjo Hospital. A new standalone building is already nearing completion. This will boast of accommodating 28 beds that will start as an ICU and an isolation center for severely or critically ill COVID patients. The state government also approved the relocation of services and personnel from Stella Obasanjo Hospital to the Edo Specialist Hospital, so that the whole complex will be dedicated for the active response to COVID-19. So we're going to have the whole of Stella Obasanjo Hospital as a dedicated complex for COVID-19 response. The center boasts of all the facilities that will be required for handling coronavirus disease. We have a state-of-the-art incinerator, a very large one. And as we speak, we're also working on getting the Stella Obasanjo complex as a center that will receive all forms of complaints from the citizens of Edo State. Whenever they are, when they have symptoms that is suspicious of coronavirus. So we are having a tent being put in place that will be for consultation and will be for triaging, so that patients will be selected. Those that fit within the case definition will be taken over to the isolation center. And those that are not will also be managed at that facility. We have another isolation center at the Irua Specialist Teaching Hospital. This has been in existence for years, but the state government is also strengthening the facilities there and improving on the services. Of course, we know that we have a testing center that is there now, the only testing center among the 5 in the country. Edo State government is planning to have more diagnostic and testing centers. Work is in progress to have another molecular PCR machine to be brought to Edo South and one to Edo North. We also have another isolation center for Edo North, located at the Central Hospital, Auchi. Facilities like ventilators, oxygen concentrators have been deployed to this center. The specialist aspect of treatment for COVID-19 patients is commencing tomorrow. After the training of the trainers activity tomorrow, those that have been trained will be sent to the 18 local government areas to cascade this training to all the centers we have across the 18 local government. The governor has directed that we have to have 3 screening centers in each local government, and of course also in Benin to have the Stella Obasanjo Hospital. And government is planning to have massive screening of all Edo indigenes to be able to have that statistics of those of us that have contracted this virus or not.
You are all aware that we have 2 confirmed cases in Edo State, and the protocol requires contacts to be listed and followed up. So for the 2 confirmed cases, so far we have 71 contacts that have been listed and are being followed up. However, we will continue to still look inwards. If we have more cases that have contacts with the confirmed cases, we will keep line listing. It's always better to overline list than underline list contacts. The idea is for us to follow them up so that when they become symptomatic, we quickly remove them from the community to the isolation center, even before the results of the test will be out. It's either we take them to the isolation center or we ask them to self-isolate at home if they will be able to do that. So that is ongoing. Over 1,500 people have called us to give us information about persons of interest, people that have entered the state without us knowing from some of the overseas countries, and people that have some form of symptoms. They've been calling us and we've been giving them the right information. 13 persons that require attention, and their specimen have been taken to Irua, though some of them have results have been back and they are negative. We are still waiting for the rest. Why we are telling you this is to tell you that we're actually following the persons of interest. Why we are telling you this is to tell you that we're actually following the persons of interest. Apart from the ones we got from the calling, we also had persons of interest that entered the country from the airport in Abuja that we got the list, and we've been following them up. But over 36 of them have completed their 14 days and they have exited. As I speak to you now, we have 47 that we are following up. So many of them will see exit within the next 3-4 days. They must have completed their 14 days and they will exit.
Yeah, I've gotten texts and I've gotten some calls over some persons going around to say they want to collect account or whatever. The state government is not part of it. We are not part of it. And we have discouraged gathering of people, and that is still on. It has not been lifted. Please, law enforcement agency, enforce. Nobody should have any gathering more than 20, and social distance must be maintained if there is such gathering where you have to have up to 20 persons gathered. So far, the statistics that are coming in, you can discover that both day and night they are moving and they are reaching out to these people, monitoring them. We've done a lot of tests. And by the grace of God, only 2 so far have been confirmed. Others are negative. Just like the statistics the WHO just gave you, we have a lot of them. We are still expecting another set that we have sent for testing. And by tomorrow, we get the result. And if, by God's grace, they are all negative again, that will form our data. But we don't need to bore you with those that have been tested negative. By the grace of God, by weekend, we should be celebrating that our speaker is out. So we are tracking and we are following the laid down procedure with international best practice. So for COVID-19 in Edo, we're on top of it, and we are adopted a system of contact tracing and cutting the curve. And that, for us, if you check the world over, those countries that have gone through contact tracing and following up have less of this pandemic, and that is what we've been doing, and thank God it's yielding results. And another thing that we have done, we will not send any worker out there without protective kits. We will not do that, and that is why, with what we have today, we are ordering for more. After the training of these health personnel, we are deploying more, so that our health workers, none of them will be too exposed to the extent that they will also contact this disease.